So picture this. You're just scrolling through your social media feed, minding your own business, and you see an ad for a cosmetic clinic.
Oh, we've all seen them. The glowing photos, the discount codes.
Right, exactly. But back in 2019, one major clinic chain ran a campaign that had a literal ticking countdown clock on it.
Oh, wow.
Yeah. If you clicked before the timer ran out, you got this massive discount on breast surgery.
I mean, that is just, it's wild. They were running a Black Friday flash sale for a major surgical procedure, something that requires general anesthesia.
And permanently alters your actual body.
Yeah, exactly. Which perfectly illustrates this terrifying collision we are seeing right now. It's aggressive retail marketing slamming right into serious medical interventions.
They're weaponizing FOMO, like the fear of missing out, but using it to rush you onto an operating table.
You know, it's the ultimate trap in the modern aesthetic industry.
It really is. Navigating this stuff, it feels a bit like trying to buy a used car from a fast-talking salesperson.
That's a great analogy, actually.
But, if you buy a bad car, it just breaks down on the highway. You call a tow truck, it's fine. If you fall for a deceptive cosmetic procedure, you're altering your anatomy.
The stakes are just astronomically higher.
Yeah. And yet, the marketing tactics are practically identical to retail.
Which is exactly why this massive, invisible web of regulatory guidelines exists. Regulators are constantly trying to build guardrails around an industry that, frankly, desperately wants to act like a fast fashion brand.
Right. And that brings us to our mission for you, the listener, in this deep dive. We've got this giant stack of regulatory texts in front of us today.
A very heavy stack, I might add.
Oh, for sure. We're looking at rules from the UK's Advertising Standards Authority, the CMA, the General Medical Council, plus the US FDA and the Australian TGA.
And we are going to use all of these as a sort of decoder ring.
Exactly. We want to answer one specific question today. What are the definitive red flags that prove a clinic is overselling a treatment?
Basically, how do you know when they're prioritizing their profit margins over your actual medical safety?
Because once you know the rules they are supposed to be following, their little marketing tricks become, incredibly obvious.
Completely transparent.
So let's start right at the beginning of the journey. The very first thing you see, the advertisement itself.
The hook.
Right. Now, we all know the fast food burger in a TV commercial never looks like the squashed bun you get in the drive-thru.
Obviously.
But when clinics use visual illusions in their marketing, it's not just, mildly disappointing.
No, it's a fundamental compliance failure. It's illegal.
Exactly. So let's talk about the before and after photo.
Well, the before and after photo is basically the aesthetic industry's most powerful tool.
Mm-hmm.
And because of that, it's their biggest liability.
Mm-hmm.
The Advertising Standards Authority, the ASA, they regulate this through the CIP code. That's the Committee of Advertising Practice.
Right. I was reading through those rules. They are remarkably strict.
They have to be. An image acts as a visual contract for a patient. It sets a biological baseline for what you should expect.
Which means any subtle manipulation is essentially medical fraud.
Exactly.
So wait, just to clarify this for the listener, I saw in the CIP code that just switching on a ring light for the after photo isn't just a sneaky photography trick, it's an actual violation.
Oh, absolutely. It's a massive red flag. The code demands identical lighting in both photos.
Wow. It's like when real estate listings use wide-angle lenses to make a closet look like a master bedroom.
Right, but with much higher stakes.
Yeah.
You also have to use the exact same camera angle, the same distance, and the same background.
And no makeup on the treated area, right?
None. And definitely no social media filters. Not even those subtle built-in skin-smoothing ones on your smartphone.
That is so interesting. Another sneaky trick I saw in the sources was hiding the time frame.
Oh, the lip filler time frame trap.
Yeah.
Yes.
A clinic will post a photo of a lip enhancement immediately after injecting it.
When the lips are incredibly swollen from the trauma of the actual needle.
Exactly. And they pass that acute medical swelling off as the final voluminous result.
And then a week later, when the swelling actually goes down, the patient is confused because their lips look half the size.
It's just so deceptive. And that framing doesn't just stop at the pictures. It extends into the text of the ads, too.
Yeah, there is a glaring linguistic trap here, especially regarding what clinics are allowed to call the substances they're injecting.
The brand names.
Right. If you're scrolling on TikTok or you see a billboard on a bus and they use the actual brand name Botox, you should immediately be highly skeptical of that clinic.
See, I found that rule fascinating because culturally, Botox is just a genericized trademark now.
Like Kleenex.
Or Band-Aid, yeah, everyone says it. So why is writing it in an ad such a massive violation?
Because legally, Botox is classified as a prescription-only medicine, a POM.
Okay.
Under the UK's human medicines regulations, you are strictly prohibited from advertising any prescription-only medication to the general public.
And this rule applies to specific dermal fillers too, right?
Yes, because many premium fillers contain lidocaine.
Which is a local anesthetic.
Exactly. And adding lidocaine elevates this simple hyaluronic acid gel into a pharmaceutical drug.
Because it actively numbs the tissue.
Right. It alters your physiological response to pain, and it carries its own specific risks, like allergic reactions.
That makes total sense. So what are clinics supposed to say instead?
They are legally required to use generic terms, things like anti-wrinkle injections or dermal filler treatments.
Right. And the Medicines and Healthcare Products Regulatory Agency, the MHRA, they actively hunt this down, don't they?
They do. They issue enforcement notices to clinics that drop these brand names.
So if a clinic is willing to just blatantly ignore pharmaceutical advertising laws just to get more algorithm engagement,
You really have to wonder what other medical safety protocols they're bypassing when the doors are closed.
that is such a good point. Okay, along with the banned brand names, we also need to talk about the impossible promises.
The language of guarantees.
Right. If a clinic uses absolute words like guaranteed or permanent or revolutionary, that should set off alarm bells.
Definitely. And the ASA makes a very interesting legal distinction here between objective claims and what they call puffery.
Puffery, I love that word.
It's a fantastic legal concept.
Uh-huh.
It basically refers to obvious subjective exaggeration, stuff a reasonable consumer wouldn't take literally.
Like saying a facial will make you feel like $1 million.
Exactly. No one is going to sue them for not literally handing over $1 million or saying you'll get a brand new you. That's puffery.
But the moment they attach a number to a biological outcome,
Then they cross into objective claims, and those require peer-reviewed clinical evidence.
there's a crazy ruling in our sources about this. A hair transplant clinic in Turkey called GTDHI,
Oh, yes. I remember this one.
they ran an ad claiming a 99% successful result, and the ASA banned it immediately.
Well, because biology simply does not work in mathematical absolutes.
Right. Human physiology is chaotic.
Exactly. A 99% success rate implies this near-perfect biological response across thousands of different immune systems.
And varying healing rates, genetic predispositions.
Right. No honest medical professional would ever guarantee a biological outcome with that level of numerical certainty.
Okay, so let's follow this patient journey a bit further. The clinic bypassed your logical filters with a manipulated photo and careful language.
Mm-hmm.
Now we enter what I call the pressure cooker. How do they actually force you to pull out your credit card?
By manufacturing urgency. And by doing that, they completely trivialize the reality of the surgery.
We mentioned that Black Friday breast surgery ad earlier.
Right, by Transform Hospital Group. But that is just the tip of the iceberg for high-pressure sales in aesthetics.
Well, I want to push back on this just for a second.
Sure, what?
We live in a super commercialized society. I get emails for 24-hour flash sales on airline tickets all the time.
Oh, definitely.
I see countdown clocks for shoe drops.
Mhm.
Limited time offers are just standard business practice. Why is a flash sale on lip fillers seen as a red flag?
It's a fair question, but the difference is retail purchases don't carry the risk of tissue necrosis.
Wow. Okay. Yeah. Fair point.
The General Medical Council, the GMC, they have strict ethical guidelines that say patients must be given adequate time for reflection before altering their bodies.
And a flash sale deliberately short circuits that.
Exactly. It forces your brain to focus on the financial penalty of missing a discount.
Instead of actually contemplating the physical risks of the procedure, you're panicking about a coupon expiring instead of asking, what happens if the filler hits an artery?
Right. And you see this trivialization everywhere. The ASA has ruled against clinics framing cosmetic surgery as a casual vacation, too.
Oh, the surgery abroad packages.
Yes, the websites will have these sprawling photos of infinity pools and luxury hotel suites.
But they completely bury the very real medical risks, like deep vein thrombosis from flying right after a major operation.
It's incredibly irresponsible. Or they target emotional vulnerabilities.
Like exploiting the postpartum period. Our sources highlighted ASA rulings against terms like mommy makeover.
Which is just awful.
Right.
It aggressively targets women when their bodies have undergone massive trauma, their hormones are fluctuating, they aren't sleeping.
It's the literal commercialization of an insecurity.
Another severe example was that ad run by a breast enlargement clinic called MYA.
The one that aired during Love Island.
Yes. The voiceover heavily implied the women in the ad were only confident and happy because they had surgery.
Presenting invasive surgery as this trivial, risk-free shortcut to self-esteem. And Love Island has a massive teenage demographic.
Which is exactly why the ad was banned. It led to stricter enforcement of a crucial rule. You cannot advertise cosmetic interventions in media where 25% or more of the audience is under 18.
Okay, so the urgency and the emotional manipulation are major warning signs. But what about the actual price tags?
Well, even if there isn't a flash sale, the pricing structures are often designed to mislead you.
Yeah, the Competition and Markets Authority, the CMA, has been cracking down on this tactic called drip pricing. It reminds me of booking a ticket on a budget airline. You see a flight for $20, but by the time you pick a seat and bring a bag, you've spent $200.
It is the exact same psychological mechanism, but applied to medicine.
A clinic will advertise like lip filler from 150 pounds.
And that low anchor price gets you in the door. But once you sit in the chair, you find out it doesn't include the mandatory consultation fee.
Or the premium filler you actually need, or the required aftercare products.
And suddenly the final bill is 400 pounds.
Classic bait and switch. I also saw that the CMA bans the perpetual sale.
Oh yes. If a laser hair removal package is 50% off for 12 months straight?
Then that discounted price is just the standard retail price.
Exactly. Claiming it's a discount is just a deceptive practice to make you feel like you're getting a special deal.
Okay, so you've survived the deceptive ads, you navigated the pricing traps, you finally walk into the clinic.
This is where we hit the next major regulatory concern.
Right. The inflation of expertise and the delegation of consent. Let's talk about the person actually holding this syringe.
The titles they use are heavily regulated. If a practitioner advertises themselves as fully qualified or a specialist, those aren't just casual buzzwords.
So a general practitioner who took like a weekend certification course in a hotel conference room.
They cannot legally market themselves as a cosmetic specialist. In the UK, a doctor must be officially listed on the GMC specialist register for that specific surgical field to use that title.
And what about the clinics themselves?
A clinic cannot call itself a leading clinic without concrete, verifiable evidence, like published research or major industry awards.
I noticed they play geographic tricks too.
Oh, the Harley Street trick.
Yeah, they imply they have a presence on this world-renowned medical street in London, but they really just rent a mailbox there.
While doing all the actual procedures in some suburban strip mall, it's borrowing prestige.
But the most critical interaction in that clinic isn't checking their address. It's the consent process, the moment you sign the paperwork.
The GMC's supplementary guidance is unequivocal on this. The medical professional performing the intervention, or formally supervising it, must be the one to obtain your consent.
So they can't delegate it to anyone else.
No, absolutely not.
Which makes perfect sense. Imagine you're boarding an airplane and a flight attendant tries to explain the complex engineering checks of the jet engines instead of the lead mechanic.
You would panic.
Right. Yet in aesthetic clinics, you frequently have a sales coordinator or a receptionist handing over a clipboard and rushing you through the medical risks.
Because delegating consent strips away the necessary clinical dialogue. The doctor needs to sit with you, ask why you want the procedure, and assess your psychological readiness.
If a receptionist is getting your signature in the waiting room while you sip sparkling water, that is not informed consent. That's a retail transaction.
And that retail mindset is exactly why the CMA enforced the 14-day cooling-off period under the Consumer Contracts regulations.
Right. So if you book a cosmetic service online or over the phone, you have a legal right to cancel within 14 days.
But clinics try to bypass this. They demand massive 100% non-refundable deposits up front.
They weaponize the sunk cost fallacy, making sure you show up even if you've changed your mind.
It's completely unethical.
Okay, to really cement how dangerous this overselling can be, we need to look at the frontier of the aesthetic industry.
We're moving away from standard injectables now.
Right. We're entering this incredibly complex, rapidly growing sector, the Wild West, basically. Regulators are scrambling to catch up.
We're talking about energy-based devices and what the industry calls vaginal rejuvenation.
This is perhaps the most chilling example we've found of a clinic taking a legitimate, silent medical struggle and mutating it into a cosmetic insecurity for profit.
To understand the manipulation here, you have to understand the actual biology first.
Right. The underlying condition many women face is called genitourinary syndrome of menopause, or GSM.
When a woman goes through menopause, her systemic estrogen levels drop significantly.
And that lack of estrogen causes the vaginal tissues to thin out, lose elasticity, and stop producing natural lubrication.
The symptoms are severe too. Chronic dryness, intense pain during intercourse, urinary tract issues.
And studies show this affects up to 70% of postmenopausal women.
But because of the societal stigma around aging and sexual health, only about 7% actually seek traditional medical treatment.
Even though the standard evidence-based treatments for GSM are highly effective.
Exactly. Doctors typically prescribe localized topical estrogen creams that safely restore the tissue, alongside non-hormonal moisturizers.
But the aesthetic industry saw this massive demographic of women suffering in silence.
And they realized they could market an entirely different, vastly more expensive solution: off-label laser devices.
This is where it gets incredibly concerning. Can you explain what off-label means in this context? Because the biology of what these lasers actually do is intense.
Okay, so these energy-based devices, which use fractional CO2 lasers or radio frequency, they were originally cleared by regulatory bodies for general gynecologic or dermatologic surgery.
Meaning their primary purpose is to burn off abnormal precancerous tissue?
Yes. So a machine designed to vaporize abnormal cervical cells is now being marketed as a spa-like rejuvenation treatment.
For tissue that is already biologically thinning and incredibly fragile from a lack of estrogen, that sounds completely counterintuitive.
It is. The marketing claims that inflicting controlled thermal damage will provoke a healing response and stimulate collagen, supposedly curing the dryness.
But the US FDA issued a severe warning about this, didn't they?
They did. Former FDA Commissioner Scott Gottlieb explicitly stated they were deeply concerned that women were being actively harmed.
The FDA cited horrifying adverse event reports. Women were coming forward with severe vaginal burns, deep tissue scarring, chronic unrelenting pain.
All resulting directly from these off-label laser treatments. It really is a nightmare scenario.
And the pushback from global regulators has been fierce.
Definitely. The Therapeutic Goods Administration in Australia, the TGA, they went as far as canceling the ARTG inclusion for several of these devices.
Well, wait, what does that mean exactly?
The ARTG is the Australian Register of Therapeutic Goods.
Yeah.
It's the official list of legally supplied medical devices. By canceling their inclusion, the TGA functionally forced these specific lasers off the market entirely.
Wow. So you have this landscape where a functional biological health issue is being repackaged as a cosmetic flaw just to sell an unproven, potentially disfiguring laser package.
It's predatory.
If you are a listener dealing with GSM symptoms, how do you even differentiate between a legitimate medical provider and a clinic just trying to upsell you?
You have to look at who is holding the device.
Yeah.
Guidance from the British Society of Sexual Medicine says that practitioners' qualifications are everything.
Because in some jurisdictions, non-medical aesthetic practitioners can do this, right?
Yes. Someone whose primary day job is laser hair removal on legs might be legally allowed to insert these laser heads internally.
That is deeply unsettling. They're bypassing the entire diagnostic process.
Exactly. A legitimate medical professional will act like a doctor. They'll conduct a physical exam to screen for pelvic floor abnormalities.
Mm-hmm.
They'll use validated clinical questionnaires to understand the root cause of your symptoms.
And they'll discuss first-line evidence-based treatments like the topical estrogen.
Right. They will do all of that before they ever suggest a 1,200-pound laser package.
They treat you as a patient with a complex biological system, not a consumer with a credit card limit.
And that core distinction brings us right back to our central mission for this deep dive.
Becoming an empowered consumer in the aesthetic space means actively learning to spot the seams in this glossy marketing.
You really have to view every ad, every discount code, and every consultation through a lens of healthy, informed skepticism.
So let's summarize the major red flags we've decoded today.
Sure.
If a clinic guarantees you a mathematical certainty for a biological procedure, walk away. If they try to bypass your critical thinking with a ticking countdown clock on a flash sale, walk away.
Absolutely.
If they hide their true costs behind drip pricing, if they allow a cheery receptionist to handle your medical consent, or if they promise miracle cures using off-label technology, walk away.
The regulatory bodies, the ASA, the GMC, the FDA, they exist to protect public health. But they are often playing a game of whack-a-mole with massive marketing budgets.
So your ultimate defense is understanding the rules these clinics are attempting to break.
Well said.
I do want to leave you, the listener, with a final thought to mull over today.
Okay.
As we look at the trajectory of the aesthetic industry, technology is making these physical interventions faster and seemingly more casual. You can literally pull out your phone, tap an app, and book a 15-minute lunchtime laser appointment as easily as ordering a pizza.
The friction of receiving medical care is completely disappearing.
Exactly. The guardrails are being optimized out of existence for the sake of convenience. So as that friction vanishes entirely, will society eventually lose the psychological boundary that separates a serious, risk-laden medical procedure from a standard beauty treatment, like getting a haircut or a manicure?
It's a profound question. And when that cultural boundary finally breaks down for good, who really wins? The patient seeking care or the clinic's bottom line? It's really about the future of bodily autonomy in a hyper-commercialized world.
It is definitely something to keep in mind the next time you're scrolling through social media and that bright red countdown clock on a new you starts ticking. Just remember, a bad haircut grows out in a few weeks, thermal tissue damage doesn't.